I'm Dr. Jennifer Haggar. I'm a general pediatrician at Sanford, and I just wanted to take a few minutes and talk about COVID-19 and the coronavirus in general. We're at a different stage of disease now with known community spread, and I'm proud of the steps that we're taking to make sure that we're protected as healthcare providers and that we're protecting our patients. I think it is important that we continue with those precautions in how we bring visitors, patients, and ourselves into the building, and the things that we do to keep ourselves and our patients safe. Some simple things that we can do as staff is use our PPE. If a patient is suspected or there's concern about illness, make sure we're protecting ourselves and be cautious about how you're removing those things, because that's one of the times when you can contaminate or expose yourself to illness. Hand washing, I know we say it over and over again, but making sure that that whole 20 seconds happens, that we're getting an excellent lather, and that we're thinking about how we're turning off the faucet after we wash our hands can make sure that we're leaving with clean hands and that we can go on doing the things we need to do for ourselves. I'd also have you consider the way that you're coming home to your family, thinking about removing clothing and shoes that were worn during the day, and just washing those directly so that, again, you're decreasing the exposure for yourself and for your families. Thankfully, through these precautions, we can really do a lot to reduce our risk and keep ourselves healthy. We're vital healthcare workers, and we need to continue to provide the care to our patients that we need. I personally have been thinking a lot about how being a healthcare worker at least gives me something to do in this, that I can be part of the solution, and I think you can do that as well for yourselves and for your patients and those that you care for with your residents. I've been really proud of our medical community and the way that we've worked together as a team. We've seen partnerships across health systems. We've seen partnerships with groups like Lifescape that provide such a vital service to our community. And I think as we work as a team, we see that if we're all taking the same steps, we know that those are the right steps. It's really important that we think about the information we're taking in. There's so much information coming at us through media sources, through social media that we use. And some of that is true and it's really helpful information, and some of that unfortunately creates fear, and it's an easy way for things that aren't true to spread. So I'd really encourage you, if you're hearing something that's concerning you, talk to your leaders, ask questions. They can contact medical experts like myself or others in the community to make sure that you have the information you need to care for yourselves, your residents, and your patients. Thank you for everything you do. If you need support in some way, please just ask and take the time to help with your own mental health and keep yourself well rested, active, and eating healthy foods.